first lecture on. Welcome to HSC 4630, Understanding U.S. Healthcare. This is the first lecture on healthcare management. The presentation objectives are: define management, contrast efficiency and effectiveness, explain the health management professionalism, and describe management's contradictions.
This slide contains the definition of management. It's simply an organized way of getting things done with the right information, resources, and people at the right time. It's the process that organizations use to make important decisions. And according to Harold Kuntz's The Management Theory Jungle, it's getting work done through others, done properly, on time, within budget. It is the process composed of interrelated social and technical functions and activities occurring within a formal organizational setting for the purpose of accomplishing predetermined objectives through utilization of human and other resources. Let's talk a little bit about the healthcare administration history. In the early days, the 1800s and early 1900s, hospital administrators were only in hospital settings. They were originally called superintendents and were typically nurses that were doing administrative functions. In 1933, the American College of Healthcare Executives started as the American College of Hospital Administrators, but changed its names a number of years ago to reflect the broadening field beyond hospitals. The name changes have also taken place in other associations to reflect the broadening of opportunities in healthcare administration. These include the Medical Group Management Association, which originally started in 1926, and the Healthcare Financial Management Association, started in 1968. There are three primary objectives of healthcare administrator. First are the business and financial aspects of the healthcare organization. This includes assuring that the service is delivered efficiently and effectively. I'll present these important concepts later in the lecture. The business roles of healthcare managers include human resources, financial management, data collection and analysis, and strategic planning and marketing. Next, healthcare administrators are responsible for the care of people at their most vulnerable, when they're dependent on the health services of the organization. Finally, healthcare managers are responsible for the moral and social order of the organization. They must advocate for patients, arbitrate when values conflict within the organization, and act as an intermediary between various professional groups. Public health administration takes place at government and social agencies such as local health departments or child and maternal health clinics. As you've learned previously, public health focuses on prevention of disease, whereas personal health is more concerned with intervention. Practically speaking, however, the lines are blurry as more public health organizations are providing medical intervention for financial reasons. Nonetheless, a distinction can be made between public health and personal health management. The core functions of public health include assessment, such as epidemiology and research, policy, such as health planning, and assurance, which includes inspections, health education, and occupational health and safety. Finally, disaster preparedness and response is a critically important function of the public health administration. It incorporates all of the core functions I just mentioned in order to manage emergencies for populations. I will present more information on disaster preparedness and response later in the lecture. I will now broadly discuss the cycle of management functions in healthcare. These functions include planning, organizing, staffing, directing, and controlling. It's important to note that the cycle is continuous. The organization will go through a process of planning, organizing, staffing, directing, and controlling. But then the process will repeat itself again and again as the organization adapts to the changes in the external environment. We will begin our description of these functions with the top, planning. In planning, a manager must decide in advance what is to be done, articulate the desired outcomes based on mission and values, and evaluate alternatives, develop goals and objectives. Moving to the right, we have organizing. These activities include arranging people and activities to carry out the work, creating departments by profession or product line or clinical service. Main considerations include the chain of command, so who reports to whom, and the spans of control, who is responsible for what. Function number 3 is the staffing function, which includes selection and placement, training and compensation of personnel, and the appraisal of existing manpower against organizational needs. It also includes manpower acquisition strategies, such as whether to promote or demote employees and hire or lay off workers. Next, directing activities include giving guidance on what to do or what not to do, setting expectations, and monitoring performance. The 5th function is controlling activities, such as monitoring and evaluating performance and assessing whether goals are achieved. If these goals are not being achieved, then an intervention may be necessary. The necessity for intervention when goals are not met is called accountability. Accountability means being answerable to important stakeholders for decisions that affect organizational performance. Managers must be accountable to goals such as improving the health of a population and providing high-quality care at reasonable costs, otherwise known as value. However, there are challenges associated with holding managers accountable in a healthcare organization, and foremost of which is the ambiguity of the definition of health. As presented previously, health as a concept must be operationalized with specific measures. As a result, managers become accountable for specific measures of health, and these are usually measured only in the short term. Effectiveness and efficiency are very important concepts in the study of healthcare management. Effectiveness measures the degree to which goals are achieved. Another way of saying this would be goal attainment. Efficiency, on the other hand, refers to producing the largest results for a given amount of resources. Efficiency reflects the greatest benefit at a given cost. Efficiency recognizes that resources are constrained, so we need to realize the biggest bang for the buck. Remember that effectiveness measures the degree to which goals are achieved. And keep in mind that effectiveness can be measured in different ways depending on perspective. For an owner of a business, effectiveness may be return on investment. For employees, work satisfaction and compensation. For customers, satisfaction with the quality and the cost of goods or services. For the local community, the contribution to community health. Finally, effectiveness for a government entity could be compliance with laws and regulations. Keep in mind that this implies that goals are appropriate and meaningful for the organization. In other words, goals are designed to benefit the organization, to make it more successful. And suppose we distribute a customer satisfaction survey to patients upon their departure from the hospital. An example of an acceptable goal would be to achieve a response from patients. At least 95% of them rate the hospital's performance as above average. Another acceptable goal would be that these patients rated the hospital experience as above average. At least 80% of them rated their experience during the hospital as excellent. You can readily see why the accomplishment of these goals would make the hospital more successful, and in this case, it would help in making the hospital more marketable. So we see that organizations are more effective when managers choose and achieve appropriate goals for the organization. Efficiency is important because of the focus upon minimizing waste and using time and energy judiciously. Efficiency is measured by the ratio of useful work performed relative to total resources used. Efficiency reflects the greatest benefit at the given cost. And keep in mind, however, that costs are easy to measure. Benefits, on the other hand, may be difficult to measure. I will provide an example that will illustrate how organizations can sometimes be efficient but not effective, or effective but not efficient. Sometimes organizations are both efficient and effective, and sometimes organizations are neither efficient nor effective. A hospital has different nurse-to-patient ratio on different units with similarly sick patients, for example. The different units have ratios of 1 nurse to 1 patient, 1 nurse to 2 patients, and 1 nurse to 8 patients. The hospital measures effectiveness, in part, through patient satisfaction scores. So which unit is most efficient? The most efficient use of resources would be the unit that has the ratio of 1 nurse to 8 patients. 8 patients are cared for with 1 nurse. We may also say that the 1 nurse to 2 patient ratio is more efficient than the 1 nurse to 1 patient ratio, twice as efficient. But now let's review this situation in terms of patient satisfaction, which is a measure of effectiveness. It's likely that 1 nurse to 1 patient ratio is most effective. This is simply because 1 nurse can devote all of his time to 1 patient. Workload is not spread out over 8 patients. So you can see that the unit with 1 to 8 nurse to patient ratio is efficient, but not effective. The 1-to-1 unit is effective, but not efficient. What is effective management? Effective management ensures quality and desired outcome. Effective management ensures disciplined and organized effort against specific challenges and problems of each organization. As I presented in the figure above, planning is the first step in the cycle of management functions. In planning, a manager must decide in advance what is done, articulate the desired outcomes based on mission and values, evaluate the alternatives, and develop goals and objectives. Planning provides a number of benefits. First, focus. An organization needs to know what they do best, what problem needs to be solved, and the needs of their customers. Flexibility. An organization must be willing and able to adapt to their environment. Action-oriented. This means to stay ahead of the competition, to be proactive, results-oriented, priority-oriented, and change-oriented. Number 4 is coordination. Planning helps coordination between many different individuals, groups, subsystems, and systems. Then there's time management. Planning offers organizations the ability to continually optimize their time. And finally, there's control. Planning helps measure performance and helps tell how well things are going and what could be done to make it better.
Management function. COVID-19 mass immunizations. Imagine you work for a community health center or public health department. You want to respond to the pandemic by mass immunizations of a recently developed, FDA-approved and manufactured COVID vaccine. Let's walk through the steps of the management cycle to accomplish this. So you are the health services manager of this community health center or public health department. First is planning. Remember, you must decide in advance what is to be done in a way that is consistent with your organization's mission and values. Since you work for a community health center or a public health department, are you focused on maximizing profit? No, equity is more important. Bill Gates wrote, during a pandemic, vaccines and antivirals can't simply be sold to the highest bidder. They should be available and affordable for people who are at the heart of the outbreak and in greatest need. Not only is such distribution the right thing to do, it's also the right strategy for short-circuiting transmission and preventing future pandemics. So, you need to prioritize who will get the COVID vaccine given that the supply will be limited, especially at first. How many vaccines do you plan on delivering? In what amount of time? What will be the demand for the COVID-19 vaccines? Moving to the right in the management cycle, you need to organize. These activities include arranging people and activities to carry out the work. So you need to create a COVID-19 vaccination team. Who's in charge of the clinical aspect? What about supply chain? That is, who will order the supplies and where will they be stored? Finally, where will the immunization function happen? In the regular clinic or in the parking lot? These are the organization issues that you need to work out. Function number 3 is the staffing function. How many nurses or medical assistants do you need? Do you have enough now, or do you need to hire temporary employees for the period during vaccinations? These are the staffing questions you need to ask. Next, directing activities include giving guidance on what to do. You need to set expectations and monitor performance. How many COVID vaccinations will your clinic deliver each day? What should be the maximum patient wait time? What is the process for delivering vaccinations? How do you ensure that these procedures are followed? The 5th function is controlling activities, such as monitoring and evaluating performance. You will post the number of vaccinations delivered each day relative to the goal. Everyone will be able to track the process because the charts will be accessible by everyone. If these goals are not being achieved, then an intervention may be necessary, such as a redesign in process or coaching and training of the employees. Management professionalism. Unlike clinical professions, health administrators are not required to have licenses. No license is required, so that threatens the professionalism of healthcare administrators. We lack the exclusivity afforded to clinicians who earn their practice license, such as medicine, nursing, and allied health professionals. As a result, we have sort of a quasi-profession status. As a result of no licensure, we sometimes are subordinate to the clinical professions in the social and political structure of the healthcare organization. This means that we need to behave with a certain level of professionalism to retain the respect and power afforded to those with licenses. So what does it mean to behave professionally as a healthcare manager? Well, it can mean a variety of things. Some of the professional behaviors include adapting to organizational norms on how to dress, act, and work collaboratively, committing to the achievement of diversity, inclusion, and equity in the healthcare organizations, embracing a continuous improvement orientation to ensure organizational achievement and highly reliable health services practices and safe patient care, seeking feedback and personal growth through reflection, participating in professional association activities such as lifelong learning, mentoring, and community collaborations, and holding themselves and others accountable to standards of performance. Healthcare managers also have a tremendous amount of responsibility compared to the management profession overall. Responsibilities that are uncommon in most other industries include the intense regulatory oversight in healthcare, around-the-clock demands for services, and life and death consequences of our decisions. With the important responsibilities of the healthcare manager comes the opportunity to work on the interprofessional team. Interprofessionalism is what happens when individuals from multiple health disciplines collaborate to deliver care. Interprofessional education has been defined as situations where two or more professions learn with, from, and about each other to improve collaboration and the quality of care. Interprofessional collaboration can be difficult, though, when the health administrator is not viewed as an equal partner on the interprofessional team. Some have negative perceptions of management, viewing the administrator as causing undue burdens on clinicians who are there to care for patients. One such provider is the physician ZDogg, who's actually a very funny YouTube sensation, often making jokes about the healthcare system, where the health administrator is played by Darth Vader. In this serious post, though, Z-Dog says it's not burnout, it's moral injury, complaining that health administrators try to do interventions about something that they are probably responsible for. That is, the health administrator is blamed for the difficult working circumstances of clinicians. And he says, and that's what they call burnout. It's not burnout. The next administrator who tells you they're trying to manage burnout, you go tell them to, you can read the rest. But some find the health administrator to be especially helpful in the interprofessional team. Colleagues and I did a study with medical students where health administrators were involved in group activities. And one learned a lot about the role of the health administrator, saying to me, I think a huge barrier in communication between health administrators and physicians stems from the fact that our education is so different. Our end goals seem different, when in reality, they're the same, to improve healthcare quality for our patients. I feel that where the conflict arises is that physicians don't understand the costs and the business side of healthcare, whereas the health administrators have to be the bad guys sometimes and reel in the costs. So I think that ends up heavily impacting the collaboration. Wise words from this doctor-to-be. Clinicians often misunderstand the role of the health administrator, partly because there are contradictions in the role of the healthcare manager. In these next few slides, we'll discuss the contradictions in healthcare management. Healthcare managers balance the need to plan, organize, direct, and control with the need to react to everyday management challenges. Healthcare managers uniquely contribute to patient care, often without detailed clinical knowledge. Healthcare managers combine the art of leading people with the science of evidence-based management. Healthcare managers embrace the need to create profits, but also serve the community. Healthcare managers control costs while at the same time improving patient care quality. Healthcare managers are planners, they're organizers, they love order, and yet the healthcare manager needs to respond to everyday challenges, often problem-solving issues that come up on a day-to-day basis. This duality of planning and reacting is a marker of healthcare management. Healthcare managers are a part of the interprofessional team, and healthcare managers uniquely contribute to patient care, often without detailed clinical knowledge. Clinicians are specialized in caring for patients with their medical knowledge to diagnose, treat, care for patients. And yet, healthcare managers can contribute in unique ways, bringing business skills and people management to the healthcare team. What are the unique skills of the management profession? For one, they seek out and resolve OFIs, or opportunities for improvement. An achievement orientation means that they're always driving for improvement. If performance goals are not met, seeking ways to improve those. When they are met, seeking ways to challenge the organization to get even better. Healthcare managers create patient flow efficiencies to improve productivity, removing the waste from the healthcare process. Setting and monitoring performance goals to make sure that the organization is moving in the right direction. Promoting strong individual performers, recognizing responsible and accountable employees and staff, and allocating funding for enabling technologies to improve the delivery of healthcare. But do these unique skills of the healthcare manager actually contribute to patient care outcomes? Yes, in some cases. McConnell et al. Found that management impacts health of heart attack victims. Those hospitals that care for heart attack patients who have managers with effective practices in process improvement and performance management were found to have a lower 30-day mortality rate for heart attack victims. So, healthcare management, at least in this study, makes a difference to patient health outcomes. Healthcare managers combine the art of leading people with the science of evidence-based management. The duality of art and science is an interesting combination that makes healthcare management a fascinating career. Working with people is an art. Leading people, especially to get them to change, is especially artful practice of healthcare managers. Kotter's 8 steps to change are described in literature, but also a very popular and charming short book called Our Iceberg is Melting. In this, John Kotter and his co-author walk through 8 steps to change using penguins and an allegory to explain the change process. And there's a science to healthcare management. Something called evidence-based management means that translating principles based on scientific evidence into organizational practices. That means identifying the best practices, what works objectively, and then implementing that. Good quality decisions should be based on the combination of critical thinking and the best available evidence. This rigorous approach to management complements the art of working with people. Evidence-based management is an expression of the more logical, analytical mind that healthcare management requires. We use evidence and the scientific approach to avoid cognitive bias. When making decisions, we can often be led astray by certain biases that we hold as humans, such as the confirmation bias, which confirms existing beliefs, the self-serving bias, which makes decisions just to maintain our self-esteem, the affect heuristic, which is falling in love with the first idea, availability heuristic, when examples come to mind, and groupthink, which is following a herd mentality, agreeing with the group, not necessarily the best decision. These cognitive biases get in the way of making the right decisions in healthcare management. So, we approach problem solving using evidence. Healthcare managers also face a duality between the need to create profits and the need to serve the community. Healthcare managers embrace the need to create profits, looking for ways to reduce costs, to improve revenues, and to create profits for the organization. However, certain times the needs of the community take precedence over profits, investing in services that may not make money but support a community need. In fact, healthcare delivery, especially hospitals, has a social services history rooted in the religious organizations that founded many of the country's hospitals. The Catholic healthcare system, for example, was once run by nuns. In fact, they used to say that healthcare was in the hands of the sisters of Catholic hospitals to manage. In fact, the values of healthcare managers tend towards the communitarian, the idea that we're supporting the community, not just out for profits. Health services managers value excellence, stewardship, respect, teamwork, and compassion. These are not typical management values found in for-profit organizations. Healthcare managers seek to both control costs and to improve patient care quality. Often seen as diametrically opposed ideas, healthcare managers view this as the paragon of performance. Efficiency and effectiveness can occur at the same time by reducing the wastes involved in the healthcare system, from processes and supplies that are wasteful to not using people to their fullest capacity in the healthcare team. Healthcare managers focus on delivering value by increasing quality and decreasing costs. In conclusion, healthcare management is a unique profession. Managers are responsible for increasing efficiency and effectiveness. And healthcare management is full of contradictions that actually make the career interesting.